This is the part that you can fast forward because I don't have any prepared comments and nobody's here yet. Um, as you can see, I'm in the park and I'm kind of sweaty because it's hot. It's like 85 degrees. I've been riding my bike and I've been doing this thing lately when I go to the park, ride my bike, then I stop riding my bike and then I do a live. Usually that live is at TikTok, but today we're gonna try YouTube because I haven't been on YouTube for a while. Hello, Erica, my one and only viewer right now, Erica. So I guess Melissa Tang. Hello, Doc. She says, good to see you. I'm really honestly going to start scheduling these. It's just lately in the last year, I really can't schedule things because my schedule is so crazy that I have to take advantage of the time when I have it. If I find myself open for 45 minutes, then I'll do a live. But here in a couple of weeks, I'll actually be able to start scheduling. Troublemaking Pups says hello. Yeah, so let's see. Sarah Jones, Twinkin 2, hello, good to see you. Hello to everyone. As I was saying, I know that a lot of times people watch these after I am done. I leave and go on with other things in my life, and then I get a lot of comments that they're, kind of like sad that they missed the live or whatever, and that I should schedule them. And absolutely, I want to schedule them. It's just right now, at this point, it's tough for me to schedule, but starting around June 15th or 16th, I think I'm going to actually be able to schedule my lives, both here and at TikTok. And then that way people can, if they want to tune in, they can kind of make a little bit of time for it. I think that's great that people care so much because, usually it's the same folks who come. But if you have any questions or comments or random stuff you want to talk about, and it wouldn't be a live without Chloe Clevenger. Good to see you. Maggie is here. So does anyone have any questions or comments or any other things to talk about? I personally don't have anything specific to talk about today. I usually just kind of go with it based on the questions. I know I have 4 autopsies scheduled for tomorrow. So it's what I would expect after a Memorial Day weekend, which is motor vehicle accident, drug overdoses, or suspected drug overdoses. And the other one is a decomposition. We don't really know why. So question is, am I retiring or am I just cutting back on hours? I am not retiring. To me, would mean that I am completely out of medicine. I'm not doing autopsies any longer, and that I'm sort of just completely switching gears. That's not the case. I am still going to do autopsies, and I am still going to do court stuff. So it's still going to be related to my job, but instead of doing like 400 autopsies a year, I'm going to be doing a lot less, like 70 or something. And basically, I am switching the focus of my career more on creativity, which is sort of more who I am as a person anyway. And I've been working like a dog for 8 years in forensics. And now I'm going to be doing more like teaching. So I'm going to have a lot more presence on YouTube, a lot more presence doing lectures, and doing consults, but also doing like lots of other stuff that I like to do, like making short films and producing art and stuff like that. So I guess you could call it a semi-retirement, but I am definitely not going to be doing forensic autopsies every single day. Colette, good to see you. And then somebody says, am I watching basketball tonight? And presumably you mean the Celtics versus the Heat. I am probably, I'm actually, I've been a Celtics fan for a long time. I am a Celtics fan because I grew up in the same county as Larry Bird. So when I was a little kid, that's who I looked up to. So yeah, I'm hoping the Celtics win because I don't like the Heat just in general. Have I started on my next book? Yeah, I mean, I actually started on the next book shortly after I finished the first book, but I've been so busy since 2020, about mid 2020, that I have had no time to sit and really put it together. So yes, writing will be one of the big things I do. I'll be producing more books, more YouTube, hopefully more podcasty type stuff. I'm going to be doing less day-to-day cutting and more kind of teaching, really. I guess you could, because when I do a podcast, I kind of look at that as teaching. And maybe some other lectures, like we've talked about paid lectures, but most of my stuff's just going to be free on YouTube. And my thought was, when I have something that's very gruesome, graphic, lots of violent content, when I talk about homicides and things like that, probably will do those not on YouTube, mainly because YouTube will punish me for doing that. So I have to be careful with how I do my content on YouTube. They're a little more lenient than TikTok, but not a lot. For some reason, Instagram, YouTube, they've really clamped down, because I used to post on Instagram, like, I don't know, 5 years ago, I used to post really graphic stuff and it never got flagged. And now I post like a liver and then I get a community guideline violation. And I see Christian is here. Good to see you. We've got Celtics fans and Massachusetts people in here. I personally, I did not get to see Larry Bird play in person as a Celtic, because the only games I would have been able to go to are Pacers games, and we lived like 115 miles from Indianapolis, and we would not have went there to watch. It's just, when you live in a small town like that, you go to Indianapolis like once every 2 years or something. But I did get to see him play in all-star games that he hosted when he was actively an NBA player. And that was really cool. A guy I know who helped build my parents' house when I was about 12 or 13 was a very good friend, like one of Larry Bird's best friends. And so I was 1 degree of separation away from him. Probably my greatest, I'll tell you, probably my greatest accomplishment, even beyond medical school, is that when I worshipped Larry Bird, and I don't mean like I literally worshipped him, but he was certainly my basketball hero, and I modeled the way that I played after him. So he won the title in '86. He won the title in other years too, but they won the title in '86, and I happened to be playing basketball in '86, in 6th grade actually. And our first game was against Springs Valley. And that's where Larry Bird played in high school, was Springs Valley. So my first game, I got to play in his gymnasium. And the funniest part is, I had practiced moves that he used to do. And so the first 2 baskets of the game, I scored them, and I used a Larry Bird move against Springs Valley to score those baskets. So that's my favorite lifetime accomplishment over all the other things that I've done, I'm just going to say. Let's see here. So Boston's being crazy. Let's see here. Sarah says, I know someone who drinks coffee until 4 p.m., then wine until bedtime daily. They don't drink water at all. Says there's water in coffee and wine. I'm wondering what's going to give out first. I would say that person is technically correct, that they are taking water in by virtue of drinking coffee, I would be concerned about drinking too much wine between 4 p.m. and bedtime. Um, I am not a big fan of alcohol when I see the amount of damage it can do to a body, especially in chronic people who chronically use alcohol. It's very serious and it can get out of control very quickly. So I would be concerned about that. Yeah, London says, nice to see you back. Yeah, I haven't really done a YouTube live in a while. I did make a short earlier today, and I never make shorts, but I'm going to start trying to do shorts more often because I'm trying to grow my YouTube presence. My idea is that I'm going to be teaching medicine here on this channel, but my angle is that it's through the lens of pathology, because I believe that the best medical doctors are the ones who understand the pathology the best surgeons too. So what I'm going to do is I'm going to try to teach little mini lectures of medicine that people, and they don't have to be in medicine, they could be just people in the community, they can be high schoolers, pre-med and college, international folks who maybe there are some countries that don't have very good support for their medical education. I want them to watch my channel, and I'm going to do medicine lectures, but they're going to be pathology lectures too. And then I'm going to have special just forensic lectures. So that's going to be, my content is going to be kind of a mini medical school, a mini forensic lecture series. And I will be covering, of course, the current event stuff, celebrities that die and things like that. Podcast will primarily be at YouTube. But like I said yesterday in my TikTok live, I'll be pulling the audio off of the YouTube video podcast and putting it up because I know people like to listen. Instead of just watching. So that's probably what I'm going to do. I think there's a lot of interest in learning medicine for people who maybe they wanted to go to medical school and didn't. Maybe they're just curious. One thing that strikes me is when I talk about hypertension, and you know that I am obsessive about hypertension, talking about that. And I have a lot of people message me and they say, hey, I wasn't taking my blood pressure medication, but now I'm taking it because of what you told me about hypertension. And so those people they're not medically trained. They have no medical background. They don't really know anything about medicine. And yet they're going to take their blood pressure medication because they learned about the pathology of hypertension. So now apply that to everything else. Apply that to all these other diseases that I can talk about. And I feel like I can reach more people, be more helpful as a doctor doing that than actually practicing medicine. Although I have helped a lot of people practicing medicine. Will the lectures be on the podcast or on this channel? So it's going to be on this channel. Like I'm going to have, I don't know exactly what I'm going to call it yet, but kind of like a mini medical school lecture. And it's going to be here at YouTube, not going to be a podcast. Those are not going to be podcasts. I guess I could do that, but it's probably not going to be the Knife After Death podcast. I guess I could split it and make a different one, mainly because the Knife After Death thing is very deeply forensically oriented. I talk a little bit about like celebrity or popular current event type death, things like that. And I kind of want to keep Knife After Death that way. Mainly because although this channel is named Knife After Death, I'll probably just leave that the way it is. But yeah, I mean, I guess I'm not sure. I don't think I'm going to make it a podcast in its own self, but maybe that would be helpful for people. Because like I said, people like to listen while they're exercising, and they like to listen while they're driving on long drives and stuff like that. So Christian says, I just put your live on my outdoor speaker, pool Memorial Day evening. It's great. Well, that's great. I'm happy I don't know how entertaining, I don't know how I could be more entertaining than music or a movie or something, but this was a spontaneous live, like literally 98% of my lives. And so I'm glad that everyone who's attending is attending. And as I said earlier, if you've just joined, in a couple of weeks, I'm going to be able to start scheduling these instead of just popping on. And that's because I'm cutting my work schedule way down so that I can spend more time teaching and creating content, stuff like that. I feel like I have put in a lot of my life. I have put in a lot and sacrificed a lot since I got into medical school. And now I want to have a little bit better life, but still be able to help people. Let's see here. Chloe says, I'd love to hear what you consider your biggest accomplishment within forensic pathology. So one, well, there's multiple, I think, but one is that we've never lost a case where I have been the pathologist on doing the autopsy. So most of those are murder cases, like 99% of them are murder cases, and we've never lost. So that's nice to be able, hopefully I can retire from that sort of thing undefeated. And if the pathology is bad, that allows criminals to walk free. And if the pathology is ironclad, that makes it much more difficult for the defense. So I would say probably that's going to be my number one. Number two is that I have been able to make observations during autopsies that have been key for justice, not just the undefeated thing, but observations that without the autopsy there would not have been any kind of trial or conviction or arrest or anything. So the biggest accomplishments in forensic have been the justice side of things. In fact, I even for just a second, I thought maybe I'll just go to law school and I'll just become a lawyer too. But right now, I kind of don't want to do that right now. Maybe I'll do that in a couple years. But I really enjoy the court side. But what I don't enjoy about the court side is how much it screws with my schedule. So for court, obviously, you have to do depositions. You have to drive. I usually have to drive a long way for court. The timing is never accurate. So if they say you're going to testify at 1 o'clock, it's hardly ever at 1 o'clock. It's usually like 2 or 3 o'clock, and you're sitting there waiting in the courthouse. So I have to blow a couple of days of my life just for every single trial. And that is very annoying. But physically being in court is not bad. Yeah, medical knowledge is entertaining and proactive care. And that's right. I feel like there's a lot of people who simply just don't understand how the human body works. And if they understood a little better, they would maybe take better care of themselves. So I've been thinking about this a lot lately because I see a lot of misinformation on TikTok. And as you've noticed, I don't really go after those people. There's other doctors that they'll stitch people and they'll drill every single point. And they do a good job. They absolutely destroy the person's points. But the problem is there's so little foundational knowledge from the other person and all the people that support them that it actually doesn't change anything. When a doctor or medical professional makes a video like that, they do a good job, but it's almost like self-aggrandizing, like, look at how correct I am, but it's not actually correcting the problem, which is people who don't understand how the body actually works. So I'm hoping that by putting more of a presence of myself doing that sort of thing, you're going to get people understanding maybe a little bit more about how medicine works, about how the body works, and there's going to be, in theory, less of, I guess you would say, maybe it would diminish the misinformation. That's what I'm hoping. Hello from Wisconsin. Yeah, I've been here for a little bit, about 20 minutes. So you'll be able to watch this after I get off here. I was planning about 30 minutes on this live. If my phone battery dies first, then it'll be less than that. So Maggie says, your information helps people be less afraid. You present the information seriously and clearly. You have people's trust. And I was thinking about that too. I think for me, the biggest thing that I can do is be trustworthy, be a trustworthy medical source. I mean, that's like the most important thing to me. I would be sad if I knew that people watched my videos and they thought that I was making stuff up. So I usually like to explain it in a way that people understand. And I do that. I had a lot of practice because I've done a lot of trials. And in trials, you're supposed to testify in a way that an 8th grader could understand. And that's not to be insulting, but the reason why they do that is because a lot of people haven't had science since 8th grade. So you have to explain in a very basic science level. And so that's why I'm pretty good at explaining things. So Samantha says there's some confusion for me about manner of death. So I'll tell you word for word what I say when I'm in court, because I have to define this in court. Cause of death is a specific diagnosis. So that would be motor vehicle accident, myocardial infarction, COPD exacerbation, electrocution, struck by lightning, drowning, stroke, aortic dissection, dismemberment. So it is a specific, okay? Manner of death is a category, a general, and there's 5 manners of death in my state. I think some states have 6, but I'll talk about that in a moment. Manner of death: natural death, accidental death, suicide, homicide, and lastly, undetermined. So that's how it goes. The 6th manner of death is complications of medical therapy. So the question is, I know what manner of death is, but some of the decision making about manner of death confuses me. Well, I mean, that's case by case, you know. The way to determine manner of death is what is the inciting event that produced death. For instance, let's say you've got somebody in a nursing home 30 years because they were shot and they actually developed pneumonia and they die because they had paralysis of their diaphragm. The cause of death is pneumonia, but the manner of death is, or it'll say complications of gunshot wound, pneumonia, and then the manner of death is actually homicide. So even though you die of pneumonia, which is a natural thing, it's not natural because you wouldn't have got the pneumonia if you hadn't gotten shot with your diaphragm paralyzed, which causes you not to be able to aerate your lungs as well, which promotes pneumonia. So, you know, it's case by case. Sometimes it's very clear, you know, a motor vehicle accident is, you know, a motor vehicle crash is blunt force trauma, and then the manner of death is an accident. But if the person had a heart attack and then crashed their vehicle, it's actually going to be heart attack natural. So now let's go back here. Let's go back. How many what percent of cases do you go to court for testimony? I mean, like 1 to 3% probably, because you're really only going to testify on murders, vehicular homicides and things like that, maybe. And so those aren't all that common. So, you know, homicides are not all that common. In a fellowship, you're going to testify on probably like 40% of your cases, but when you go into practice, you won't. I've never had a cystic fibrosis case because the reason why is that when somebody dies of cystic fibrosis, the cause of death is known, usually, unless they die of some other manner, and so they don't do autopsies on those. Still confused on how some people can have brain tumors removed and some can't. So, well, it depends on the location. I mean, like for instance, if you've got a brain tumor that is within the brainstem, and it also depends on the type of brain tumor, it is essentially inoperable, because if you operate there, you're actually going to damage the brainstem, and the brainstem is where your heart rate and your breathing occurs. So that would be one example. Whereas if you have a tumor, let's say on the very outer side of the cortex, right under the temporal or the parietal bone, they can just take that bone off, take the tumor out, put the bone back. So that's why. Also, it depends on size. A tumor that's the size of a marble, 1 centimeter, versus a tumor that's 6 centimeters is going to be a lot harder to resect. How does the brain tumor kill someone? I mean, the brain tumor kills someone in this way. Depending on the brain tumor, some brain tumors will hemorrhage. They'll have like a spontaneous hemorrhage, so you die of an intracranial hemorrhage. Very often, that's what happens with glioblastoma multiforme, is you'll have an intracranial hemorrhage. Secondly is invasion of structures that are essential for life. So that would be like invading the brainstem, causing damage and necrosis, which will cause you to actually stop breathing. The third is increased intracranial pressure. So as the tumor expands, there's no room for there's no room for expansion, because the skull is set in its size. And so what happens is the increased intracranial pressure forces the brainstem through the hole in the bottom of the skull called the foramen magnum. And when you have pressure on the brainstem, so cerebral edema, you have pressure, that will actually result in death as well. This education is so needed. I was an outreach men's and women's health director. Your honest, straight educational approach, not critiquing others, is the best. You will be a treasure in education. So that's my whole goal. As much as I would like to go after these people that are willfully spreading misinformation, it just doesn't feel like it's going to be helpful. I just haven't done a lot of that. I feel like I'd rather just explain it clearly, and if people believe me, great, they should. And if people don't, I can't force people to believe things that are true, and they just won't believe it. Just like you can't force people to believe things that aren't true. So, person carrying their gun pointed at the floor. An angry person moves in front of the armed person and holds armed person's wrist above their head, and while angrily ripping gun from armed person's hand, is fatally shot. So among those, not suicide. And not fighting over the gun there's a lot of there's a lot of to that one. If you assault somebody else and like angrily grabbing at someone's gun, and the gun goes off by their own hand, would it be a suicide? No, that would be more of an accidental. If the other person is holding on to the gun and shoots the gun of the person who's attacking them, that is a homicide, but it's not a murder. So if the person is accidentally shooting themselves, it's not suicide, because they are not intending to kill themselves. But it's not a homicide because it's not the other person's gun. If it's the other person's gun, because the other person didn't have a role in pulling that trigger. If that person did pull the trigger, somebody grabs it. Let's say I've got a gun. Somebody grabs at my gun, and I am struggling with it, but my hand is on the trigger, and I actually pull the trigger and kill them. That is a homicide, but it's not a murder. The person with the gun did not shoot the person that was grabbing it. To me, that case is, I would say that case is probably an accident, but also there's another one you can do on that. You can do undetermined on that and explain, unless it is caught on tape, and you can physically see it on tape. There's a lot of questions about, well, did this person grab the gun? Did that person grab the gun? Whose fingers were on the trigger? Undetermined is not unreasonable in that case. And yes, that case is rare, and cases like that are rare. I've only had maybe one or two like that in my career. One case I had, so the death certificate says homicide before investigation was over. I mean, everybody's different. I don't think I would have called homicide on that case if the person did not pull the trigger at the other person. I would not call that, but other pathologists may have reason for that. And so the point I'm making is that manner of death is not, I think I would say it's not as concrete as cause of death. Okay? That's what I would say. Well, can a death certificate be corrected? A death certificate can be amended or corrected if there is agreement with the authorizing person who signed it. If the person signed it and they believe it is a homicide, that is the person who signed the death certificate, it will not be changed. It's not going to happen. The way that in my state, I'm the pathologist. The coroner is the one who signs the death certificates. The coroner is the one who, regardless of what I say, they can certify the manner of death. And then if I, happen to disagree with them, they can override me legally speaking. So that case, it's, at most, you might be able to have somebody else review it and issue a different manner. But the problem is finding people to do that is very hard because people don't want more legal burden. For instance, I have somebody message me every week on TikTok asking me to look at an autopsy report so that I can give my opinion and change the cause and manner of death. Well, I always say no. I've never said yes to that because if I change it, I am now ensnared. It is grabbing me and ensnaring me into that case, and then I am legally tied to that case. So that is really, really tough. I don't like to get legally involved with cases unless they are physical cases that I have physically put my hands on. Now, writing opinions, sometimes civil attorneys will ask me to write opinions. Do you agree with this cause of death? Do you agree with this manner of death? And I write opinions, and that's okay. But when it comes to that sort of thing, that may be the difference between a trial and not a trial. So yeah, you could maybe have it reviewed, but that's the only thing I could recommend. All right, we're at 33 minutes here. I was planning on 30, but I can answer a couple of questions, a couple more questions if you want. Christian says, wow, can't believe people will ask you for that. Yeah, I have had a lot of people on TikTok asking me, look at this photo and interpret this photo. And okay, now that you've said that, now I need you to write a report to send to my local, attorney and medical examiner, all this stuff. And they just don't understand. This is not a game. The legal system is very serious. There are people in this country who seem to get away with everything they do. Usually those are rich people and politicians. But regular people in the community don't want to be ensnared in that. And I am one of those people. So usually I'll humor them and I'll say, listen, I think what you need to do is you need to get a consult, but I'm not the guy. I'm not hard up for work. I'm not hard up for money. So I don't take everything. Sometimes people will say, what do you think about this photo? Does this look like a gunshot wound, or does this look like a stab wound or something? And I have no problem saying, yeah, that's a stab wound, or yes, that's a pancreas cancer or something like that. But that doesn't legally ensnare me. If I issue a formal opinion, then I am inside of that case. Did you finish Breaking Bad and watch Better Call Saul? I did finish Breaking Bad, but I have not watched Better Call Saul. In fact, I haven't watched any TV or movies hardly at all in the last couple of months, and that's because I'm changing my career path a little bit, And because my daily hardcore autopsy work is coming down, um, hopefully to zero, but it won't be zero. I have been working around the clock to get all my cases signed out. So when the day comes, I don't have any cases that are lagging behind. So I haven't had time to watch anything. I do want to watch Better Call Saul. The Breaking Bad thing, I think seasons 1 through 4 were perfect, but I had some issues with season 5 actually. Yeah, my issue is that I have a problem with taking the main character of anything, a show or a book, and making you hate the main character for all of his terrible actions. I think that's problematic. That's just my personal opinion. I like to be able to have some redeeming qualities of my main character. So if I write fiction books, I can tell you that I'm not going to write characters that my main character is not going to be someone that you hate. You might hate elements of the main character, but you will not finish the book and say, I literally hate everything about that person. But my next book probably won't be a fiction book, but perhaps the book after that will be a fiction book, because writing fiction is what I was doing before I went to medical school. Yeah, so that's what I would prefer to be doing. Succession, yeah, I hear that word come up every day, but I don't even know what it's about. Let's do a couple more. Isn't that good writing? What do you mean? To make you hate the main character? No, I don't think that's good. I want to watch or read something and finish it and not hate the main character. I don't need to love them. I don't need to buy posters of them, but I don't need to say, this is the most reprehensible human being I have ever seen in my life. That's my problem with that. So no, I know that it's very common now among writers to do that sort of thing. Well, so yes, if a reader has a strong emotion on something, I don't know I don't know that it's necessarily a good thing. I guess it's better than no emotion at all. So I will give you that. I will tell you that having no reaction to a story or a character is much worse than having a strong reaction. But the strong reaction, like, I feel like people, they want outlets, they want stories and movies and things like that because they want an escape from reality, which is already pretty terrible. They want things that they not necessarily need to make them perfectly happy, but just something to give a little bit of gratification. And that's how I feel about. And again, my other writers do not have that theory. There is a director, and I'm not going to say his name, but let's just say he did a Star Wars film that was very unpopular. So I've narrowed it down to like 4 people. And his writing theory and his filmmaking theory, and he has said this publicly, is he wants people to go to the theater, and when they leave, he wants 50% of the people to love it more than anything, and 50% of the people to hate it more than anything they've ever seen. And I personally think that is that's garbage to me. That is my personal opinion. I believe that is terrible. You don't need everybody to like your stuff. I wrote a book and not everybody liked it. Almost everybody did. But I don't have any like main characters. That wasn't a fiction book. With fiction, I feel like I would say the ratio should be more like 80-20. If 50% of the people that watch your movie or read your book hate it more than anything they've ever seen, you didn't do a good job. And that's my personal opinion on that. Again, I am a doctor. I am not a writer, so maybe my opinion doesn't matter that much. Frida Kahlo's death, is controversial. I don't know anything about her death. I guess maybe I should look it up. and I don't know if it's controversial or not. I haven't heard much about it or anything about it. Book was great, by the way. Learned so much. Great for the layperson. Thank you for that. Thank you for that. If you want to go to Amazon and write a review, that's helpful. The book was intended to be an educational book, so I'm glad you learned something. Sort of a fun way to learn about forensic concepts. The second book, I'm not sure if it's going to be like that or not. I'm still debating on what to do with it. But anyway, thank you for your comments about the book. For anybody watching this who doesn't know who I am, maybe they're coming in and they're a new follower to my page. The book is called The Handbook of Zombie Forensics and Medicine, and my last name is Wolfe. So if you type that into Google or Amazon, it will be the first hit, and you can purchase that. I also have copies. I have some copies in my library at home that I can sign and send. I've done that for a few people here that attend this live. I've done that for probably half the people here. So yeah, I've got maybe 50 left, I think. And then after that, there will be no more printings of that. So I'm kind of happy to put it in the rear view. I think I would have probably written another couple of books already if it weren't for the pandemic. The pandemic screwed up a lot of stuff from a work situation for me. And so I feel like I worked a lot harder after the kind of that first big peak in the pandemic. So somebody says how to get one. Well, like I said, if you want to order one that's not signed, you can just go to Amazon, or you can go online and order it at a number of different places. I think somebody even told me they got it through Target once. But if you want a signed copy, the best thing to do is to email me and ask for one, or you can direct message me at my Instagram or at my TikTok. Instagram and TikTok are both the Dead Letter, and I'm pretty sure you can reach me through email here on this page. There's probably a button for my email. And then basically it's like the price varies. I mean, it's like $20 usually, but if people want me to write a big long inscription or something, I usually $25. Sometimes I just do $25. Mainly because they're becoming rare at this point. And so it'll probably be printed again in another format, mainly because I think a traditional publisher will pick it up as soon as I have time to start sending queries to traditional publishers, which I have not had time. But in 2 weeks, my life is going to be different. So I'm very happy about that. And with that, I think I will say thank you for your time, and I'm going to go ahead and get off here now because I have a little bit more riding to do on my bike, and then I'm going to head home and I'm going to eat dinner. So thanks for everybody. We got about 20 people here, which is cool. That's good for a spontaneous live, and hopefully in the future when I schedule them, we can have more people here. And they gave me the ability to do lives with other people. So maybe we can have other people on here going live with me. I generally don't like other people. No, I'm just kidding. But if we want to do like a dual thing, that would be fun. But anyway, thanks again, and I will see you next time.